Hello, I'm Ashley Jones, a developer relations engineer based in the US, and I'm going to go over the latest release, which came out at the end of last month, CHT Core 4.21. Next slide, please. So we're covering 4 main features, but I'm actually going to lightly go over the priority task sorting because there's going to be a demonstration right after my talk. So the 4 features that we're covering in 4.21 are the ability for forms to reach into the user's contact summary. And like just about all the features in recent versions, this came out of the need for the community. Specific Xenia, who we just heard from, had a need for in digital payments to keep track of the monetary amounts that were applicable in the forms, as well as for stock monitoring to ensure that the balance of medication in the supply of a CHW didn't go into the negative. Priority task sorting will give you the ability to, in the task list that's presented to the CHW, to rate a specific task at a higher level, and we'll hear more about that shortly. Another feature coming from the community is the ability to have a link to edit a contact when you're within the task. While it does break out of the flow of the task, it does allow you to more quickly get directly to the contact. We're also very excited to see CouchDB upgraded to 3.5. We don't have any hard numbers on it just yet, but we've seen some major performance improvements from this, and we're excited to publish those once we have verified them. And the CouchDB upgrade comes from an early feature that we were able to deploy today for the CHT 4.0 5.0 release that's coming up. So anytime there's a feature that's standalone and offers its own benefits, we like to ship that before the full feature, as long as there's benefit to the community. And of course, there's a lot more bug fixes and other technical improvements, and we encourage folks to check out the release notes. Next slide, please. As I mentioned, thanks for posting the release notes there in the chat. All the features that you saw today largely were not only for the community, but were also helped develop by the community. Here's a complete list of all the contributors who gave their time. Some of them are medic staff, some of them are very much not, but we wanted to be sure to highlight all of them. All of our release notes always include a list of everyone who has helped contribute and deliver a specific feature in the release, and we're always really appreciative of your time. Thank you very much. Unless there's any questions, I want to push on so that there's time for the demo. Oh, I see that Adrian had a comment there. Good to hear. Thank you. I'll pass it back to Anthony for the demo.
All right. Adrian, would you like just to share the user story for that user contact summary, if you have a minute?
So thanks, Anthony. So what used to happen was we had negative values. So within the forms, you would dispense medication on by a user, but it wouldn't pick up from the contact summary. So the commodity balances appear as a contact summary. So you'd not have the auto deduction working. So at times you'd find that a user would be able to dispense to the negative values. So in a case where you have 5 say albendazole tablets, you would go ahead and dispense even what is not indicated on the contact now summary. So it then means that right now, if you have 0 albendazole tablets, then when you're going to offer a service, like in the say campaign work that was shown previously, if you have 0, then you cannot dispense at that point. Yes, so yeah, so it's very, very helpful. I'm actually excited that it's come to work, and I can't wait for the implementation. Yes.
All right. Thanks, Adrian. Hopeful the team can test it soon. And also thanks to Jennifer for raising that issue on the forum, which has helped the team just prioritize that and be able to fix that. So because of time, we can move to the task prioritization feature demo, and passing over the mic to Xenia to take us through this section.
Thank you, Anthony. So I'm Xenia. I work for D3 International here in Zanzibar. And we've been working on this feature task prioritization with the community squad. Thanks everyone who was involved in that already. So you can go to the next slide. So why did we even bring up this topic? So you can see on the right-hand side that our program increased from maternal and child health to many different tasks, which is TB, NTD, family planning, EDS, malaria, etc. With this, a lot more tasks shall show up in the CHWs screen, which makes it some overwhelming to and maybe difficult to decide which one do I have to prioritize and which one is more important if I'm not able to do all of them. So that's the key challenge we were facing. And we were thinking maybe we can get some kind of prioritization to guide the CHW in this process. So when you go to the next slide, I want to show a small example. So let's say we have Asha and Radia. Both of them are pregnant, and we have for both of them an antenatal care visit. Asha is 22 years old, doesn't have any risk factors. Radia is 28 years old, recently had a miscarriage, and has been pregnant more than 5 times. Now, if I only had time for one of these 2 visits, I think in this example, it would be very clear that I would rather do the visit with Radia since she has many risk factors than with Asha. So if you go to the next slide, the way we implemented this is based on a quite easy concept. So each task has a priority score. And this priority score depends on the task type. So what type of task is it? Is it an emergency referral? Is it an ANC visit? Is it a child visit? As well as the individual risk factors of the person. So did she have previous pregnancy complications, or is the client HIV positive, etc., etc. And then the tasks would be sorted according to this priority score. If a task reaches a certain priority level, it is displayed as high priority in order to indicate to the CHW that this task is very important to complete. So if we're coming back to our example on the next slide, and we click forward, then we can see for Asha, the task priority score would be 8 because this is the task score we have assigned to pregnancy ANC visits. For Radia, however, if you continue, the recent miscarriage would add +2 because the miscarriage would add 2 risk factors, and that it has only been recently would give additional risk factors. And if you continue 2 times further, also that she has been pregnant more than 5 times would add onto that. All of these numbers, of course, they are changeable. So these are custom now in our case. So all of this would give Radia a risk factor of 14. Clearly now you see that Radia would be above Asha and indicating that she should be treated first. Now, maybe this case was quite straightforward and the CHW would have done this anyway. So if you go to the next slide and press one forward, what if we had Lulu as well? And Lulu is 36 years old, is quite small, which is a risk factor for pregnancy, and is HIV positive. So now the question is, who of these three women would you treat first if you only were able to treat one person? And through the priority score, we are able to actually steer this from a programmatic point of view. So I don't have the numbers here because I wanted to show this in the demo. So I'll quickly share my screen. But if there are any questions up until now, feel free to ask.
Can you briefly speak to how you codify these different scores for the risk factors? And if that's going to be covered in the demo, then I can just wait and watch the demo.
How we choose these scores?
No, how you encode them into the risk factor so that it gets higher up in the task priority.
Okay, how we encode them. Like, yeah, I think I'll try to include it in the demo. Yeah. So I've already created the tasks to be prepared here. So here we can see the Radia that we had before. You can see here she has a risk factor of 14. You can also see there are many more tasks. So just to highlight like what the problem could look like. And then we also, if we scroll down, we can find Asha down here with a risk factor of 8, so much lower. In between, we find Lulu. She has, at the moment, she has a risk factor of 9 because she's 37 years old, which would already add 1 point because it's more risky to have a pregnancy at that age. So now to come to your question, we want to make sure at the moment it's not yet encoded that Lulu has HIV and it's not yet encoded how tall she is. So if we go to people and we have Lulu, what we have is in our workflow, the way our workflow works is that we have, for each person, we have a medical history form, emergency referral, and a health assessment form, as well as a vitals form. So these are kind of assessments forms that we use to filter which tasks are important for which person. And so here in this case, in the medical history, I would choose for Lulu to have HIV, but she doesn't have cancer, she doesn't have tuberculosis, she doesn't have leprosy, she doesn't have hypertension, no diabetes, no disability, no epilepsy, no sickle cell, no depression. And she's taking ARV. So now I'm submitting this form. And what I can see now is that her score for her task has changed from 9 to 12, moving her up in the priority scoring. So I also want to add that she's rather short. So I would go to the vitals form because that's where we have where we measure the height. So let's say she's 149. She's maybe 50 kgs. Well, she's pregnant, let's say a little bit more. I don't know how much. Her waist circumference is, let's say, 80, and her hip circumference 100. We did not measure blood pressure at the moment. And if I submit this one, now you can see that her priority score did not increase. I guess that's, I tested it beforehand, but you know how it works. Let's try it again. Submit this one. Well, it's not working right now. I don't know why, but
Xenia, I think it changed from 12 to 13.
It did. Okay.
Yeah.
Yeah, true. It did 12 to 13. Good. Thanks.
Yeah.
Thank you, Anthony. Okay. And so now we have 13. So if we're going back to the tasks, we can also see that Lulu moved up in the priority. So she's now here, whereas before she was all the way down here with the priority score 9. did this, are there any questions, or did this answer your question as well? Any other questions? Great. Then I'll get the mic over to Sam in that case.
All right.
Hi, everyone. Lauren, I think you're sharing screen. Could you please go to the next screen? I'm Samuel Okwalinga, a software developer from Sentinel based in Uganda. So I was part of the team that worked on this feature, the task prioritization feature. This is part of the community focused initiative that MEDIC introduced to allow community members to help in developing features, fixing bugs. And as you can see, for this feature, several teammates from different organizations collaborated: D3, Datalytics, Craft, Sentinel, Guild Digital, and with support from MEDIC itself. Next slide. In terms of how this feature was developed and how to implement it, there is a documentation, comprehensive documentation that can help. Maybe it will be shared in the chat. So in terms of lessons learned, there are quite many, but one thing that stood out for me was local context. So this feature, as you can see, it came up because of different issues in different communities, different implementations, particularly the area where D3 was working, Zanzibar. They had that issue of so many tasks and failing to prioritize which to take on. So that's why we had to work on that. But in other areas, for example, in Uganda, they actually prefer looking at tasks by due date. So this feature is still backward compatible. If you want to use the former implementation of just due date, it can still work. If you want to use priority scoring, as Xenia has presented, you can still implement it. And the documentation, the link to the documentation is in the chat. The other thing, in terms of working as a community, one thing I've really loved is the respect for community input. So everyone is welcome. There are currently several squads that are going on that are working on other features that will be released in the subsequent releases. So the community is welcome to participate, and definitely there'll be a lot of learning. As we know, working in open source, there are many opportunities, learning several features technically, and even for those who are not tech savvy, there's a lot to learn. So everyone is welcome. Thank you.
All right. Thanks, Sam. Any question to Sam and Xenia?
Maybe one more addition to the question asked before. So in our case, some of the information comes from this medical history and vitals assessment forms, but some of them also come from like the pregnancy forms or the tasks already filled out. So these can be these conditions can be they can be personalized for the use case. Yeah.
All right. I think also this issue was shared by Jennifer on the forum. Jennifer, I'm not sure if the fix that we currently have can support CHPs in Kenya to prioritize the self-assessment form.
Anthony, we are yet to test that. I think I'll respond once that's done.
Okay, thank you. Thanks,
There was
Xenia.
a question in the chat. So the question is whether it would be better to prioritize tasks that are due after the risk priority sorting. So saying sort first by the risk and then within that by the due date. This is exactly what it is at the moment. So we first sort by the importance, by the priority score, and then within the same priority score, we sort by due date.
All right. Thanks, Apuva, for the question, and also Xenia and Sam for the response. We can move to the next last slide. Phil, you can take us through the community announcements.
Thanks, Anthony. We can move on to the next slide. Yeah, but first, my name is Philip Mwago. I am a community engagement coordinator here at MEDIC, and I'll be taking us through the last part of this roundup. Some sort of covered most of what I wanted to talk today, and he mentioned input from the community. So we came up with a community meetup where it's a space just for everyone to join, listen, share, and collaborate. So we're just trying to build a vibrant community. Like Sam has mentioned, we pick up, you can discuss any topics or priorities or needs that you may have for the community. Sometimes this evolve into stuff that will work in the future, or we will probably come up with a code and then just work on these features, and then they will be released in these releases that Mr. Jones talked about and Sam also alluded. So in our next meetup, that will be next week on Tuesday at 1 p.m. GMT, we'll be talking about, we'll have a presentation on utilizing AI, and we'd like just to invite everyone just to join this call. Share your experiences with AI, and the format here will be an open discussion, and we are happy to we are extending this invite to everyone on this call. So this call happens every fortnight, so we have it twice a month. So that's it in terms of the community meetup. We can move on to the next slide. Yeah, so for the announcements, we have a community, the Q2 community survey. So I'll just share a link. Yeah, I think it's been shared on the chat. So this is open until 21st of July. So please share your feedback here as you fill the form. For the upcoming events, we have the community meetup, which is next week. We have the dev hour, which is a week later. The next Thursday, that's same time, 1 p.m. GMT. And then we have the dev demo hour on August 7th, and the next roundup will be held on 14th of August. That's the second Tuesday. Yeah, so we'll share the recording and the notes in the forum after this. Please feel free to subscribe to our calendar on the forum. That's it. Back to you, Anthony.
All right. Thanks, Phil. I'm not sure if anyone has any final questions or thoughts. Please, a reminder to fill the survey. We are excited just to hear what the community thinks and any initiatives we could be able to improve on. So because we are past the time, we are grateful to all the presenters, the MOH team, the CHI team, the Sentinel team, the D2 team, and also the MEDIC team, and for all of you for your engagement and participation. So we hope to see you again in other activities. So wishing you well for the rest of the day, and let's continue the conversation on the forum and many other channels. Thanks, and have a wonderful rest of the week. Thank you. Bye.
Thank you.